You can use the mic, sir. No, recording it's easier for us to record the audio.
So let me welcome you all and thank you so much coming in such a messy rainy day and reaching the venue at least at time. And so I am Dheeraj Nasa. I'm Country Business Director for Isorte. And today we are here to launch and to make a press release for one of the Asia's first veterinary MRI installed at MaXPetZ hospital. MaXPetZ, a small introduction I would like to give and then I will pass it on to the stakeholders. MaXPetZ, you can see the legacy started in 1952. One of the premium setup for veterinary care, and it has a complete setup in terms of when we talk about a tertiary care hospital in human. Similar setup they have it for the veterinary patients, especially for dogs, cats. We call it canine, feline, and some exotic animals, which they will mention in their introduction later. So we, through this media, we want to put it in the news that this is going to be Isorte's first in Asia. Isorte is one of the world's #1 veterinary imaging company in the world, and we are pleased and feel proud to introduce Magnifico Vet, which is a whole body MRI for veterinary animals. With this, I will pass it on to Dr. M.M. Sharma, who is the chairman of MaXPetZ, and then they can pass it on to their other colleagues and the other directors and the CEO.
MRI is known to all of you because in every home, one of the members at some time of adversity has had MRI. Now, the MRI units in the human side, they are having a cage kind of a thing, it slides and they feel claustrophobic at times. Now, the machine which Sorte is offering for the veterinary services, this is three-side open. There is no cage. Animal is not put into a cage where anesthesia and things cannot be monitored. So that is one advantage. Then number two, the machine, the latest machine, is of more magnetic power. You have mentioned that. Now, the journey of MaXPetZ as it stands today, it started in the year 1952 by my father. Then he was a veterinarian, I'm a veterinarian, and both my sons, Dr. Kunal and Dr. Bhanu, are also veterinarians. So I'm the passion for the animals, kindness towards the animals, and to the service factor for the animals, it has been getting passed on from generation to generation. And the veterinary science advancement as it is on today, it has also increased manifold from my father's time down to me, and the present time, Kunal and Bhanu. And the standards are international because Dr. Kunal and Dr. Bhanu have had frequent chances of going abroad, learning new techniques, and keeping pace with the veterinarians abroad. But at the same time, the need to upgrade the diagnostic arm is very important. Say ultrasound, high-tech ultrasound, digital X-rays with very good quality. Then earlier we had introduced, a CT scan. That's another version of smaller version of MRI. But now since MRI is there, so we should get upgraded. Dr. Kunal and Dr. Bhanu, they are doing, heart surgeries, brain surgeries, spinal surgeries. So for that we needed perfect diagnosis, the root cause of the problem that needs to be handled surgically. So that's why from CT scan and ultrasound and the earlier X-ray units which were there, we needed to upgrade and have a clearer picture through MRI, so that the protocol of treatment whether surgical or medicinal, that can be chalked out, and one is not playing on the push, but your treatment is effective, and one can be sure of good results wherever it is possible. Now, I'll pass on to Dr. Kunal and then to Dr. Bhanu. Then our Chief Executive Officer will also talk to you. On to Dr. Kunal.
If you allow, I can ask the question to him and then he can build up on that. Dr. Kunal, let me first introduce Dr. Kunal because whatever I know about him, Dr. Kunal is a leading orthopedic and neurosurgeon in India for veterinary patients, and they have leading setups, eight leading setup of MaXPetZ in India, and I have more oftenly seen him traveling for doing a hip replacement of their patients. These days, who would have imagined that such kind of practice where knee replacement, hip replacement, and sort of a thing is possible in animals. And he was the one who've been invited by various universities. They have put up a curriculum where they learn and they call him for giving lectures to their students, and that's how he's doing this noble cause and taking care of the patients. So I'm just handing over to Dr. Kunal and ask him that how this MRI is going to help to you, to your patient in taking your decisions.
Thank you for the kind words, Mr. Nasa. So in the past we've been using human machines and human labs for performing MRIs. Now there is a huge limitation if you only have X-rays, ultrasounds, CT scan. There are quite a lot of diagnostic images which you don't see, and then you miss out on diagnosis. A lot of such diseases were unnoticed, went unnoticed, undiagnosed, and then the patient dies, whether it was a human being earlier days or now it's in the veterinary setups. We're talking about dogs, cats, rabbits, guinea pigs, birds, etc. With the diagnostic capabilities and improvement in diagnostic abilities in any field, whether it's medical or veterinary, overall you tend to pick up a disease in its earlier course and then you are able to treat. So the longevity of the patient improves and also the quality of patient improves. Right? So you're trying to maintain the quality of the patient, giving a good quality of life and improving the longevity so that they live longer. Just like humans are living longer nowadays. Right? Similarly, veterinary patients are also living longer thanks to the diagnostics which are available these days. Our journey to look for an MRI machine started many years ago, about 5 or 6 years ago, where we were trying to figure out which is the best MRI which will suit our needs. So we wanted an open system. We wanted a system which will give us high resolution images. We wanted a system which will give us a full body MRI. And Esote, this machine, Magnificio, is the only machine which offers the whole body MRI. And since it's an open system with a permanent magnet, it gives fantastic resolution, high resolution images. And we are able to monitor the patient because our patients are anesthetized. Unlike a human being who's not given anesthesia for an MRI, but our patients have to be given anesthesia, general anesthesia, even to perform the MRI, because the patient does not stay still while the MRI is being conducted. So we have to give a general anesthesia. We needed to have a machine which allows us to monitor the patient, which allows us to perform an MRI on a patient who has a pacemaker inside or has a implant, say an orthopedic plate, screws. So this is a technology which allows us to do all that. And when we met Mr. Nasa and Esote's team, we were educated on how this will be useful to us. And we are planning to use this in orthopedics, neurology, cardiology, musculoskeletal system, tendon, ligament injuries, muscle injuries, etc. So this is something which is going to be very, very useful to us and the small animals in this city and around the city and possibly the entire North India.
Thank you, Dr. Kunal. Is there Hindi media people also? Should I have to say something in Hindi also? Okay. जैसे कि डॉक्टर कुणाल ने बताया कि जो मैग्निफिको एमआरआई कैसे पेशेंट्स की उनका जो स्कैनिंग है इट इज़ गोइंग टू हेल्प उनको मदद करने वाली है सर्जरी के अंदर। ऐसे ही जैसे मैंने बताया कि MaXPetZ जो चेन ऑफ सेटअप है, टर्शरी केयर सेटअप है एंड दे हैव अ डेडिकेटेड टीम। हमारे ही बीच में डॉक्टर भानु हैं, डॉक्टर भानुदेव शर्मा। वो वेटनरी वर्ल्ड के लीडिंग कार्डियोलॉजिस्ट हैं एंड ही हैज़ कोलैबोरेटेड विद लॉट ऑफ यूनिवर्सिटीज़ इन अमेरिका एंड इन यूरोप फॉर कार्डियोलॉजी वर्क। और मैं अभी उनको बोलना चाहूँगा कि वो कुछ बोले इसके ऊपर, बिकॉज ये जो एमआरआई है जो पेशेंट की आर्टरी के अंदर ब्लॉकेज है उससे पेशेंट का प्रोग्रेसिव कार्डियक एज पता किया जा सकता है इस एमआरआई के अंदर। सो वी विल टेक हिज पॉइंट ऑफ व्यू एंड ही इज अ लीडिंग कार्डियोलॉजिस्ट। डॉक्टर भानु।
Thank you, Mr. Nasa. Firstly, with the launch of this MRI machine, ये खाली हमारे लिए नहीं, ये मेरे को लगता है कि ऑल ओवर इंडिया की जो वेटनरी फ्रेटर्निटी है सबके लिए ही बहुत बड़ा बोन इसके लॉन्च से होने वाला है। बिकॉज प्रीवियसली जब हम ह्यूमन इमेजिंग सेंटर्स पे हमारे को एमआरआई करवाना पड़ता था तो बहुत उसमें लिमिटेशन हमारे को होती थी। एनेस्थीसिया मेंटेन करना जो है वहाँ पे थोड़ा एक चैलेंजिंग काम होता था। अब यहाँ पे क्योंकि इन हाउस है, एक ऑलरेडी जो एक एस्टैब्लिश्ड वेटनरी हॉस्पिटल है वहाँ पे हमने सेटअप किया है। सो यहाँ पे एनेस्थीसिया मेंटेन करना दैट इज़ गोइंग टू बी वन थिंग। उसके साथ में अगर कुछ क्योंकि ये कॉम्प्रोमाइज पेशेंट्स होते हैं जिनका हम एमआरआई करते हैं, तो अगर बीच में कोई भी अगर क्राइसिस होती है, मेडिकल क्राइसिस होती है, तो उसको हम बेटर यहाँ पे हैंडल एंड मैनेज कर पाएंगे। बिकॉज ये एक ऑलरेडी इस्टेब्लिश्ड वेटनरी क्लिनिक है जहाँ पे हमारे पास सारी इमरजेंसीज जो हैं वो हैं टैकल करने के लिए। एंड एमआरआई के लॉन्च से, एमआरआई सर्विस होने से जो एक वाइड एरे ऑफ एलिमेंट्स होती हैं वो मेरे ख्याल से हम बेटर अब उनमें हम बेटर कर पाएंगे एनिमल्स के लिए। एंड कई पहले बहुत बारी ऐसा होता था कि जहाँ पे पेशेंट आया एंड जिसको एमआरआई की ज़रूरत है, एमआरआई ना होने की वजह से हमारे को दूसरी इमेजिंग मोडालिटीज़ के ऊपर रिलाई करना पड़ता था। फॉर एग्जांपल एक्सरे, अल्ट्रासाउंड, सीटी स्कैन्स। बट वहाँ पे हमारे को कहीं ना कहीं पे हमारे को ये महसूस होता था कि यहाँ पे एमआरआई होने का हमारे को एमआरआई ना होने का काफ़ी एक डिसएडवांटेज था। सो वो अब वो चीज़ महसूस नहीं होगी। एंड मेरा फोटे जो है इंटरवेंशनल कार्डियोलॉजी एंड क्लिनिकल कार्डियोलॉजी है। विद टाइम हमारे को इसमें और हम फॉर कार्डियक पेशेंट्स हम कोशिश करेंगे कि विद द एमआरआई इन आवर सेटअप नाउ कि हम उन पेशेंट्स के लिए और कैसे बेटर कर सकें। अपार्ट फ्रॉम दिस एमआरआई का जैसे आप सबको पता है न्यूरोलॉजिकल कंडीशंस, अगर कोई ब्रेन की कंडीशन है या स्पाइनल कॉर्ड की कंडीशन है या लिगामेंट या टेंडन की अगर कोई प्रॉब्लम है, मस्कुलोस्केलेटल प्रॉब्लम है, तो उसमें इमेजिंग के तौर पे ये एक बहुत ही बड़ा फ़ायदेमंद इमेजिंग डायग्नोस्टिक टूल है वर्ल्ड ओवर। एंड आई एम extremely happy that we have this machine now, and it is, as I said, that it is not just an advantage to us and to our setup here. It is for the whole veterinary fraternity of India, and इससे बहुत सारे और veterinary clinics और बहुत सारे और veterinary doctors जो हैं उनको फ़ायदा होने वाला है। एंड हम सब एक टीम के तौर पे एक इंडियन वेटनरी फ्रेटर्निटी के तौर पे हम सबके साथ मिल के काम करना चाहेंगे। एंड इसमें हम आगे हमारे और भी काफ़ी प्लान्स हैं विद मिस्टर नासा कि हम एक जो हमारी कोलैबोरेशन जो है उसमें हम ट्रेनिंग्स ऑर्गेनाइज करें मिलके, जिससे जो बाकी वेटनरी डॉक्टर्स हैं उनको एमआरआई कैसे इंटरप्रेट करना है उसका भी नॉलेज मिलेगा. सो वंस अगेन मैं ये कहना चाहूँगा कि ये एक बहुत बड़ा बूम होने वाला है वेटनरी इमेजिंग के लिए ऑल ओवर इंडिया.
Now, the veterinary world is not only restricted to small animals like dogs and cats. In the past, during my father's time and my time, we were associated with the Delhi Zoological Park. We have treated large cats like lions, tigers, and some other animals which are confined to zoo cage system. These animals can be transported for MRI, and their problems which may exist, treatable problems, will be able to treat that. And then since India is a country where economy depends on farm animals, we have the dairy, then we have the in the higher up Himalayan ranges, we have the bhed, bakri, and yaks. These animals, if the facility can get open to some other area in India, then probably trained veterinarians, they can get they can train government hospital veterinarians to carry on MRI procedures, and if the animal needs treatment, very specialized treatment, it can be brought to Delhi at our center for surgical intervention. So what I mean, we are not only thinking of people who can afford costly animals, we also want to share and take this facility to state animal husbandry departments if they associate and they make up a all India scheme for high tech procedures which can be diagnosed through MRI only. So this is what I feel. Now on to Mr. Nasa.
Thank you, Mr. Chairman. Again, I would like to, because some of our friends have just joined us, and thank you for being here, even in such a messy rainy day. Again, I would like to summarize about the launch of this MRI project Magnifico at MaXPetZ in Greater Kailash. And again, if you see the MRI, the build of an MRI is a purpose-built MRI. A four-legged patient animal, which is a four-legged animal, can be this MRI has been designed from their perspective. You must have seen the other MRIs which are like tunnel-like. This is an open MRI where a four-legged animal can easily be scanned, easily being monitored. Like most of the animal, 100% of the animal are under anesthesia when there any scan, a CT scan or MRI is being done. So this MRI is being designed, built in purpose inbuilt for only for veterinary animals. And as Dr. Kunal, who is a leading orthopedic and neurosurgeon for veterinary animals, has mentioned that how this MRI is going to help him in various brain surgeries, in various spine surgeries, in various other joints and ligaments surgeries. And not only that, the parents of the pet are concerned how the surgery happened. Post surgery also, he can do an MRI and show it to the parents that how the surgery went well, how's the implant look like. So this is what the thought process of MaXPetZ, and as you have seen the legacy which Dr. M.M. Sharma has mentioned, his father in 1952 started this veterinary practice, and then him, and then now carry forward by both his sons, Dr. Kunal as well as Dr. Bhanu. And before I move to Mr. Arun Vasudevan, who is the Chief Executive Officer for MaXPetZ, I would like to ask him that you already have 8 setups in major cities like Hyderabad, Lucknow, Mumbai, Goa, Delhi and UP. and we would definitely like to know about the vision, how you are going to bring this sort of a healthcare practice to various other part of the country. Thank you.
Thank you, Nasir. First and foremost, I just want to clarify we are MaXPetZ. Our brand is obviously very important. Our mission is to improve access to quality healthcare. Obviously, for pets, that's our focus. It's always been healthcare is our focus. Today, we have about 20 clinics across 8 cities. The cornerstone of our success is to ensure consistent, empathetic, and quality pet healthcare. Given that focus, we have been over the last several decades, which you heard before, the vanguards when it comes to new surgical procedures, new new diagnostic procedures, as well as new treatment options. What this MRI will envision, or what we envision this MRI will do, and here I speak more as a pet parent, I'm not a vet, as a pet parent, is take the level of diagnostic to a whole different level. The other change which has happened in this country as well as across the world is the change in paradigm from a pet owner to a pet parent to a parent. So we actually look at this more as a pediatric care rather than veterinary care, and that's how the market is evolving. To your question, in terms of our expansion plan, I think we are very clear, we have a very ambitious expansion plan, but having said that, we are crystal clear also that we will be prudent in how we expand, because the cornerstone of our success is that ability of providing consistent quality pet healthcare. That necessitates the type of vets we have, the expertise we have, training, the paravets, and the infrastructure. So yes, we will expand, we'll double down where we are present, we'll look at newer markets, but we will be prudent in our expansion. The other thing is also we are very keen on sustainability in terms of how we sustainably expand in terms of unit economics. So this will drive us, or that will be our North Star guiding us forward. Thank you.
You can now take questions first in Hindi and then in English from any one of us, if you want.
I would like to start. It's a good, we were never aware. I've lived across the road for 21 years. I was never aware that this existed.
It's good, you're kind-hearted and you have interest in animals.
And I have been to IVRI as well. IVRI.
Yeah.
So I think that was when my association was about horses. So I just wanted to understand, does IVRI today have this MRI machine?
No. IVRI doesn't have MRI machine. The biggest problem in government institutions is the finance. And for high-tech things, there has to be somebody going abroad to learn the procedures. Now, fortunately, with the help of Mr. NASA, we have a machine which is the same machine that is working in Japan. So, India is not lagging behind. What is available in the foreign world, say advanced country like Japan, a sorting machine is working there, and now same we have there. So, the veterinary fraternity, whether it is from the government side, or RVC people, there's a chance of trainability on MRI machines, and these, high, institutions which have lots of money and they can generate money, they can focus money for one particular project. If they go in for MRI machine themselves, or the veterinary universities where the young graduates they qualify and then they work all over India, in different sectors. So it is something which is going to expand and show its goodness on a wider platform for better diagnosis and utility. And of course, it's not only MRI, the procedures, later on, say whether it's some muscular problem or tendon problem or brain problem or some neurological problem. There has to be a multi-specialization of doctors. MRI is just something to tell you, this is the problem. The problem area, once it is pinpointed, then it is in the hand of the physician or the veterinarians, especially the surgeons or the specialized doctors who can do the rest of the job. Right. So a lot more to come up in the coming times on on All India platform.
My question to Dr. Kunal is about recently we have a few wild animals like tigers. They develop cancer, bone, tumor. So, since you're an orthopedic, so does this MRI also you're able to detect in the imaging?
Yes, so there are different types of cancer. So when we are particularly MRI, so first answer to your first question. Of course, this machine can be used for tigers, lions, goats, dogs, cats, or even smaller versions, birds and guinea pigs, rabbits. So let's say there is a tumor in the brain or in the spinal cord of a tiger or any animal. It's only possible to detect that with an MRI. Precise location. Is it precise location and the nearby anatomical landmarks, which allows you later on to either treat it medically, go in for a biopsy, or to surgically remove it. So you are focusing on diagnostics by the use of MRI, which helps you later on to chart out a treatment plan.
Thank you. Recently, one of my friends come in from Iran. So he just told me yesterday night that he has a parrot, Tota. And he said that Tota is not eating. So uska lung effect ho gaya. I was shocked what he's talking, because, and he said his wife is going to take him to Iran, some hospital, and the lungs. So you were into cardiology. So lungs, and I think it's part of essential.
Yeah, so over here at our practice, we have different specialists. So exotic medicine and surgery, it is handled by a separate group of specialists. So we have 3 of our doctors on panel. But yes, coming to your question of lung diseases in birds, they are there. Lots of them are there. They are prone to a lot of fungal infections. Aspergillosis is one of them, just to name a few. So in birds, I mean, these set of problems definitely are existent, and if we talk about other species, dogs, cats, and all different varieties of animals which are there. So there are different imaging diagnostic tools which are there. You have X-rays, you have CT scans. So each imaging modality, it is very important to understand where to use it in which condition. Like for a lung problem, probably a CT scan may be a good option. If you want to diagnose a heart problem, and if it's a functional heart problem, something to do, for example, like the contractility of the heart, then probably your best choice is going to be an echocardiography, which is an ultrasound of the heart. If there is a tumor in the brain, or if there is a spinal cord compression because of, let's say, a disc prolapse, then your best answer to diagnose that is going to be an MRI. So a knowledge and understanding of which imaging modality to use when, that is very important. And as far as species are concerned, every species is different, and there are specialists for various species. Cat is going to have an entirely different set of problems than a dog. Birds and other exotic animals, they are going to carry a different set of problems. Over here at MaXPetZ, our focus is entirely, apart from the community practice includes, vaccinations, dewormings, basic, giving basic knowledge about the nutrition, about spays and neuters. So apart from that, which is also a very, very important aspect, when it comes to animal welfare and treatments. But apart from that, our focus is also on tertiary healthcare, which includes, super specialities. And we encourage here to all our veterinary doctors, our aim is to see, who is better in which specialty, and the interest of that particular doctor is in which specialty. And then we try to, offer trainings in that particular specialities to that particular person, so that a group of specialists is developed. So that is how we focus here on healthcare. One more thing which I would like to add is that I'm really happy with the evolution of veterinary healthcare. There was a time when X-rays and ultrasounds were a distant reality. 30, 40 years back. And then slowly, these things are a routine now. So X-ray and ultrasound is now widely available, right? Similarly, 10 years back, a CT scan for any small animal, be it a dog or cat or any other species, used to be very difficult to do that. We used to find human imaging centers. But in 2019, we launched our first, the first CT scan machine for small animals in India. And after launching that in about 1 to 2 years, we realized that how our practice has changed because of that. How the diagnosis has changed, and because of proper diagnosis, how we treat that has changed. And now with the launch of this MRI, the cases which require MRI, and then of course accurate diagnosis, and then cutting down to all the treatment options, medical as well as surgical. So in that regard, I think it is going to be a game changer. And Dr. Kunal has been doing a lot of orthopedic and neuro work, a lot of surgeries he's been doing. So I'm very hopeful that it is going to be an added feather to his work, to the work which he is doing. And as far as I'm concerned, since my forte is cardiology, so I'll try to see how we can further enhance clinical cardiology as well as interventional and hybrid surgical cardiology in India in small animals with this. So the future looks bright to me, and for me, one thing which is very important is that we grow as a community. So it is not just the growth for us as a MaXPetZ hospital, but this is also for veterinary doctors from all over India.
All right.
So together we grow.
Thank you. Some other friends would have questions.
Now for the parent, we have got a specialist doctor who has specialized in exotic animals. So, the parent, if in Delhi or can be brought to the hospital, probably, diagnosis as well as treatment available in the present times can be carried out.
Right. Thank you, sir.
Sir, what partnership or collaboration helped make this installation possible?
Sorry, okay, could you say it again?
What partnership or collaboration helped make this installation possible?
Can I answer this?
Yeah.
Can I answer this? So basically, as I mentioned, that Kisaute is one of the world's #1 company in veterinary imaging healthcare system. And as you were listening to Dr. Bhanu, who is a leading pacemaker cardiologist who puts a pacemaker to the dogs and the cats. So, and similarly, the leading neurosurgeon and orthopedic surgeon, Dr. Kunal, and the senior veterinarian, Dr. M. Sharma. Our collaboration is very clear. This is, as I mentioned, Magnifico Vet is Asia's first MRI is being installed at MaXPetZ. And our collaboration is based on the training programs which we are going to conduct for the veterinary doctors under their umbrella, and we have collaborated with the series of education program. And as when Dr. Bhanu was mentioning that, I'm just mentioning again about his vision. It is not only a top-end MRI they have acquired from Kisaute, also a top-end echocardiography system Dr. Bhanu has ensured for his sort of patients. So our collaboration is totally purely based on education and training program for the other doctors who want to learn under them, who want to, diagnose properly, because as we say that animal doesn't have the voice to, convey their pain and all, these sort of equipments will become their voice. And as Dr. Bhanu also mentioned about the evolution, this evolution has to be brought into various small towns, and MaXPetZ and Isote has collaborated to take it through all B-tier, C-tier cities also who are not having such facilities. As sir has mentioned just very shortly that the first question which he asked about the horses,
Yes.
this thing. So there are a lot of hospitals, they inquire about having what sort of an MRI, and then when it comes to the funding to this thing, I just mentioned about a small instance which I met some of the leading personnel in the public sector, and one of the reply which I got was like, I was shocking. I mean, they said that after the knee of a horse is gone, they are useless for us. So why this is a proud moment for Isote? We are not collaborating with the legacy. We are collaborating with the intent of a family. Mr. M.M. Sharma's father, in 1952, they started this practice. And Dr. M.M. Sharma might have, think of educating their children to some other field. But the love, the kindness for the animal, just very recently we lost one of the billionaire businessmen, Mr. Ratan Tata. He has allocated a budget of 5,000 crore or so. I am not confirmed about the figure, but enormous amount of this thing, because he misses that companionship, and companionship was fulfilled by his dog. So, and this is what we look into this family, that their intent, their care, their kindness, and to the level which they are taking this particular field is unimaginable. So we are really thankful, we are really blessed, and feel proud to get associated with MaXPetZ. Thank you.
डॉक्टर ह्यूमंस में तो कार्डियक डिजीज़ या कैंसर के होने के लाइफस्टाइल डिजीज़ माना जाता है, क्योंकि उनके लाइफस्टाइल ख़राब हो जाते हैं, इस वजह से ऐसा होता है. बट पेट्स में ये क्या रीज़न होता है कि उनको कार्डियक डिजीज़ हो जाए या फिर कैंसर डिजीज़ हो?
बहुत इंटरेस्टिंग क्वेश्चन है आपका. सो हम जो सोचते हैं कि ह्यूमंस के अंदर जो बीमारियां हैं, आपको वो सब सिमिलर बीमारियां डॉग्स, कैट्स, इक्वाइन, घोड़ों में, गाय, भैंस, सब में देखने को मिलती है. जैसे हमारे पास ब्रेन है, उनके पास भी ब्रेन है. हमारे पास हार्ट है, उनके पास भी हार्ट है. एक बड़ी कमाल की बात है कि लाइफस्टाइल चेंजेस जो हम में आ रहे हैं, चाहे वो अच्छे हैं चाहे वो गंदे हैं, चाहे वो मोबाइल फ़ोन रेडिएशन है, चाहे वो जेनेटिकली मॉडिफाइड सीड्स हैं, इंसेक्टिसाइड यूज़ है, पेस्टिसाइड यूज़ है, या कोई भी और प्लास्टिक यूज़ है, प्लास्टिक वाटर बॉटल्स है, जो भी चीज़ें हैं जो कहते हैं कि कैंसर या कार्सिनोजेंस हैं, जिसकी वजह से कैंसर ज़्यादा हो रहा है, तो वही सारा एक्सपोजर एनिमल्स को भी तो मिल रहा है. एक तो कारण ये हो सकता है कि कार्सिनोजेंस बढ़ रहे हैं. दूसरा एक ये भी है कि डायग्नोस्टिक एबिलिटी बढ़ रही है. तो पहले जो चीज़ डायग्नोज नहीं होती थी, चाहे वो इंसान था या जानवर था, अब वो चीज़ डायग्नोज हो पा रही है. तभी हम उसकी ट्रीटमेंट के बारे में सोच पा रहे हैं, ट्रीटमेंट कर पा रहे हैं. सो ये दो तरीके की का क्वेश्चन था आपका. आई होप ये आंसर
डॉक्टर साहब, इस MRI मशीन में सिर्फ डॉग का ही हो सकता है या किसी पेट का हो सकता है?
नहीं, जैसे बताया कि ये एक वेटनरी स्पेसिफिक मशीन है जिसमें खाली डॉग, कैट से ये खाली it's not just restricted to dogs and cats. You can use it for any animal, starting from a small little bird to a mouse to guinea pigs, hamsters, rabbits, cats, dogs, even tigers and lions. और उनके बीच में जितने साइज के जानवर आते हैं उन सबका हो सकता है.
तो कई स्टडी जो होती है MRI के आफ्टर, तो तो क्या सबकी सेम होती है क्या अलग अलग होती है?
नहीं, सबकी एनाटॉमी अलग है, फिजियोलॉजी अलग है, स्पीशी वेरिएशन है ये। सो हर स्पीशीज़ की अलग एनाटॉमी है, अलग फिजियोलॉजी है। तो उसके बेसिस पे इनकी जो इंटरप्रिटेशन है, क्योंकि एमआरआई ने तो हमको इमेजेस देनी है, उस इमेज को फिर इंटरप्रेट करना है, जिससे रिपोर्ट बनती है, जिससे डायग्नोस करा जाता है। तो एक इन डेप्थ नॉलेज ऑफ एनाटॉमी, फिजियोलॉजी ऑफ वेरियस स्पीशीज इज वेरी इंपॉर्टेंट। उसके बिना हम इमेजेस को इंटरप्रेट नहीं कर सकते। तो इसके लिए इस सॉटे के साथ मिलके हमने ट्रेनिंग्स ऑर्गेनाइज करी हैं, और ये हमारी कोलैबोरेशन है, जिसमें हम पहले हमारी टीम ट्रेन हुई है इसमें, और हम यही ट्रेनिंग्स और वेटनेरियंस को इंडिया के अंदर इस सॉटे के साथ मिलके प्रोवाइड करेंगे।
सर जो है वुमेन्स के एमआरआई के जो मशीन होते हैं उनमें और इसमें डिफरेंट क्या होता है, क्योंकि ये तो एनिमल्स हैं और वो वुमेन्स का।
इसमें अगर आपने देखा हो कि डिफरेंट तरीके की कॉइल लगती है, अगर आपने किसी को कमर का ह्यूमन में देखा होगा, तो वेटनरी में अलग तरीके की कॉइल्स होती हैं। एनिमल का इंटरफेस जो होता है, अंदर जो मेजरमेंट्स होते हैं वो कैनाइन के अलग होते हैं, डॉग्स के अलग होते हैं, कैट्स के अलग होते हैं, टाइगर के अलग होते हैं। तो अलग अलग मेजरमेंट सिस्टम्स, अलग अलग कैलकुलेशंस होती हैं इस एमआरआई में। तो दिस इज टोटली डिफरेंट sort of an MRI which is dedicated for veterinary animals. Having said this, that this is Asia's number one, the first installation of this model. इसका मतलब ये नहीं है कि हमारी एशिया में दूसरी MRI नहीं लगी हुई है, because when I met them first, they asked me, I have seen your machine in Thailand, I have seen your machine in Hong Kong, I have seen your machine in Australia, why not in India? And so they wanted some machine in India which is first time in the world, and we have just recently launched this machine in the world 2 years ago, and the first one fortunately we are installing in India. It's a proud moment for us. So this is a 100% dedicated MRI for veterinary animals.
On the technical front, when you talk about MRIs,
So I was when Madam asked sir asked some question.
Yes, sir.
I was opening up this thing when I entered into this field. I was never aware that the dolphin have 3 stomach, which I learned from them. I was sharing a picture with them. The octopus, they have 5 brains or something like that, 8 brains. So और जो ह्यूमंस में जैसे हम स्कैनिंग करते हैं, जैसे डॉक्टर भानु इको करते हैं, हम लोगों का तो फ्लैट सरफेस होता है, एनिमल सिलेंड्रिकल होते हैं। सो आई मीन दीज आर द थिंग्स विच वी बिन हमारी ह्यूमन में एमआरआईज बहुत रिसर्च यूनिवर्सिटीज़ में लॉट ऑफ लीडिंग सेंटर्स पे लगी हुई है, बट दिस इज ऑल्सो अ प्राउड मोमेंट फॉर अस। वी बिन गेट इट एसोसिएटेड विद मैक्सपेट्स. So this is all about Magnifico launch and this thing. If you have any further question, we have registration kit with some material in the pen drive which is lying at the center. We have to go out in the right. There is a setup, so you can click the pictures of the MRI live machine over there. And before that, we have also served the snacks for you. And we are very sorry about this rainy season. It's not in our hand also, but thanks to you that you have reached to the place. Thank you.
So my question on the technical front, suppose you have a Tesla machine, no, in the human MRIs. So is this also, does it have a Tesla? And how many Tesla is this machine? And firstly, we were not able to know where your company's origin is from.
Yes, so we are an Italian-based company, sir.
Right.
And we are considered as one of the top 5 imaging company in the world. If you travel to Europe, Isote is a very well-known name. And coming to the Tesla thing, when we proposed this project to MaXPetZ, they were not only concerned about the health and the diagnosis, they want something which is environment friendly also. So most of the high Tesla MRIs, they run on a helium gas. In this machine, no helium gas is required. Helium gas is on depletion, and there is a waiting of 6 months to 8 months for getting a helium fill. Another thing which they were concerned about their animals and their patient was you must have seen the other MRI create lot of noise which is scary, and generally you might get earphones to wear when the MRI is being done. It is noise free, helium gas not required, and it runs on 3 kV of electricity. Most of the MRIs they run on 50 kV of electricity, and this machine runs on just 3 kV of electricity, which is a torque of 1.5 ton AC. So they were quite concerned that how much is going to be the carbon footprint of this machine when they were considering this, which talk about their philanthropist thought process that not only animal healthcare, but it has to be environment friendly. So this is 0.4 Tesla MRI because we are in an AI era. The kind of quality of image this machine produces is even better than any 1.5T or 3T MRI. So in an artificial intelligence era, we have a dedicated feature in this machine. We call it as a hyper clarity and hyper speed. E-Spade is the feature name, which has been researched in an Amsterdam-based university and by a US-based company, so which has been incorporated in this particular MRI.
A normal human MRI is diagnosed by the radiologist. So here, do we have a separate radiologist, or just the surgeon or Dr. Bhanu would do it on his own?
Yes, because it's more of a procedural, so they can also prescribe and they can diagnose. But I will pass on this question to Dr. Kunal and Dr. Bhanu.
So here also in veterinary science now there are various specialities, and one can take up various specialities. There are specific master's program in diagnostic imaging which is offered in Europe and in some universities in US. So yes, veterinary doctors from here, they can go to those places. Over here, in our team, we have some certain set of doctors who have done courses for diagnostic imaging and who have done certifications in this. So yes, we have specific people, who are going to be doing and performing the MRIs.
सर MRI की cost क्या थी?
MRI की ये जो particular machine है, this is just recently launched. It's one of the latest machines in the world. Globally ये 1 million euros की launch हुई है.
And how much does the MRI per patient cost, say for a dog full scan?
So as I mentioned, they are more of a procedural hospital.
Right.
Like before surgery and after surgery,
So it's all
it will come
included.
into the package. Sometimes they charge and